Hi everyone, and welcome to another episode of Let's Talk Risk with Dr. Naveen Agarwal. Each week, we talk about a topic related to risk management of medical devices in a very casual and informal way. This is not a webinar or lecture. Rather, our goal is to talk about key topics and challenges in a very informal way and share best practices. I'm your host, Naveen Agarwal, and I'm the principal and founder at Achieve, where my personal mission is to help you achieve success in risk management. Guys, we have a little bit of a technical problem here. My guest today, Michelle Wu, is running a little bit behind or maybe some technical difficulties. So the show must go on, right? It's wonderful to see all of you. And I'm going to improvise. And I'm going to actually ask you to participate in this discussion. This would be more like an open forum today. And as you know, this is a very casual and informal conversation. So we had planned to talk about how AI is evolving and what are some of the interesting examples of application in the quality regulatory space that we are seeing now in the medical device industry or life sciences industry as a whole. That was our original planned topic, but we're going to improvise a little bit. And actually, I'm going to open the floor today for any one of you in the audience to come up and share your thoughts, participate in this conversation, and maybe just talk about AI and ML in general in the medical device space. What are your thoughts? Do you have any concerns? Are you seeing any interesting examples of application in your area of work? So we're going to have a little bit of a free-flowing conversation today. As always, it is a very casual and informal discussion. So I want to start inviting you right away so that we can all sort of talk about this topic in a very, very general way. So while I wait for you, I thought of giving you a very quick overview. Okay, I see, Emmanuel, you are requesting to speak. So I'll bring you on stage. And guys, don't hold back because, again, this is, again, a very informal, casual conversation. I want to hear all viewpoints. And as I've maintained in the past, all of you have interesting insights to share. So, Emmanuel, welcome to our show today. Please introduce yourself first to our audience and tell us a little bit about where AI is today in your world.
Absolutely. Thank you so much for inviting me up, Naveen. My name is Dr. Emmanuel Tkach. I'm an internist by training. I transitioned into the industry at the end of 2021, and I worked at an international clinical research organization for about 2 years, dealing with all the regulatory issues of medical devices and combination products. And I now work as a medical advisor and fractional chief medical officer for startup and mid-sized companies.
Oh, wonderful, Emmanuel. So it looks like you entered the med device industry as a physician. And I know you and I have had conversations before on LTR, so it's exciting for me to meet with you again. I would just like to invite you to start sharing your thoughts about where you see AI in general in your space.
Yes. So let me first share that I just attended the medical cardiology conference called TCT in Washington, D.C. this past week. It's an international conference where AI was discussed heavily at both the innovation panels and various other panels while I was in attendance. And one of the most important things that I took away from this conference is two. The first is that AI should be used as a tool by all those that use it, meaning physicians still have the end decision. And the second most important thing that I took away from that, and I agree with, was that AI needs to be taught how to remove all implicit bias. That means that we need to make sure that the data that we feed the AI factors in all actual data so that there's no data leakage when we're doing the machine learning process of it, so that everyone that uses the AI can understand that it's producing facts and not bias. Mm-hmm. Now, I can tell you from personal experience, the majority of people that participate in clinical trials is lacking in diversity. So, and that's something else that's being addressed not only by the innovator side, but as well as by regulatory bodies such as the FDA.
Wonderful. These are great points, Emmanuel, and I'm sure we will touch upon them a little bit more in detail today. In the meantime, let me welcome Bijan. Bijan, how are you today? Please unmute your mic and share what you have in mind about AI in your space.
Good morning. I have some thoughts about AI. AI is kind of a dynamic algorithm, basically. It learns something, it makes decisions based on the things it has learned, but if it has continuous learning, machine learning, then its performance varies over time. And that's kind of one of the challenges on how do we ensure that the device remains safe and effective over time. But they reflect on existing devices with static algorithms. They are also subject to the same types of performance variations. For example, if you have a medical device that uses an algorithm to take some decisions on a person's condition, let's say a defibrillator, these devices are subject to physiological drifts in one patient, so the performance may change even though the device hasn't changed.
Mm-hmm.
The devices are also subject to change to population changes. Like, in America, obesity is on the rise. So maybe if a device's algorithm was working 10 years ago, is it still performing the same for the general population?
Mm-hmm.
And there's also other devices and other therapies that come into the picture that could affect performance of a device. So in a way, variability in AI is not a lot different than variability on current devices, except that it just happens faster.
Yeah, that's a good point. And I know, Bijan, many people are concerned about drift in the AI model based on new data while in the field. And I believe there's a lot of effort on the part of FDA to understand pre-market, what kind of change control plans people have for their AI/ML device. So that's an emerging field. Hold that thought, Bijan. I'm going to invite Ed. Ed, please go ahead and introduce yourself briefly and tell us what you are thinking about AI in your space.
Okay, Bijan, I'm a consultant in the industry and been on the ISO 14971 committee now for 24 years. And what I wanted to talk about is a document we're working on in this space. There's a machine learning guidance for risk management being developed by the 14971 committee that will be showing up as a ISO TR 24971. That sounds familiar, but it will be a -2. In other words, it'll be a separate document. But the reason behind that is because 24971 isn't being updated right now, but at the next update, this will be incorporated into that one document. But we wanted to get that out as quickly as possible and not wait till the next update. So I don't know what the current expectation is for the arrival of that document, but when it does, I'll let you know.
Great. Thank you for sharing that. All right, Rafael, please unmute your mic and share what you have in mind about AI in your space.
Thank you very much, Naveen, and it's good to be back.
Yes.
I've been so snowed under in the AI space lately, it's not even funny. Couple of insights I've had in regard to AI. Most of what I've had to deal with is largely on the diagnostic assistance side. And in that regard, there's always that moral hazard that you have of, again, keeping the human in the loop, the professional, the doctor. That even comes over to risk management and or auditing on the quality and regulatory side, because one stunt I pulled earlier this year was I actually trained a version of ChatGPT, the commercial version, to help me conduct an audit.
Wow.
And it ran most of it. And It actually came back with something reasonable, but it missed a few key items, which ultimately got caught by my superiors. Not the best thing to happen, but lesson learned.
Yeah.
But that again is a lesson, because it can give you something reasonable, but ultimately the human has to remain in the loop. And with all the cost cutting and all the profit taking lately, further down the line, that could be a really big problem, especially when it comes to diagnostics.
Interesting. Thank you for sharing that. So, Emmanuel, I'm going to circle back with you. I think you raised a very good point about the quality of data, whether it's complete, whether it includes the diversity of patients correctly or not. So in the conference that you just attended, Emmanuel, were there any further discussions about this particular issue, and did they share any best practices?
Yes, they did. So the issue currently that, as I understand it, is that the AIs that are being trained for medical purposes, such as diagnostics, they have small data sets. And when those data sets get extrapolated, there's something called data leakage. And that in turn is what causes what, to Raphael's point, is that the AI misses things because of that data leakage. So what's important is to make sure that when training an AI, that there is, that the data sets that are used don't have that, meaning it has to be verified and sourced accurately.
Okay. So what I'm hearing you say is that there should be a little bit more scrutiny and maybe even potentially some verification very early on, even before you start to train the AI model. Did I understand that correctly?
Yes. Yes, you did. What's important, as I understand it, is to always verify what it is that you intend on using your AI for, so that you can train it and remove the bias before you have to teach it to remove the bias.
Gotcha.
So that the data is clean.
Got you. Bijan, I'm going to circle back with you now. First of all, do you have any additional thoughts on this point that Emmanuel made just now?
Yeah, actually, I do. As Emmanuel was talking about that, I was thinking about the impact of cybersecurity on AI, both interesting new fields. But imagine if someone maliciously introduced or injected false data in the training set, so that the performance of the AI will get worse. That could have a safety impact.
Yeah, for sure. Bijan, you also mentioned. Go ahead, continue, please.
I was going to say. That people use AI to also generate data. In facial recognition, you know how first they started with using human faces to make recognitions, and then they had AI generate faces to see if it can tell by itself. So fake data can generate by AI itself to then as an attack on another AI training set. Basically, AI against AI.
Oh, interesting.
Yeah.
Anyway, do you know how it went? And do you know what the result was?
About the fake data?
Yeah, AI versus AI. Yeah. What? I'm very curious.
No, this is a conjecture.
It's a conjecture.
I'm just anticipating. Yeah, I'm just thinking this could happen. I mean, if there was a malicious cyber hack that they wanted to adversely affect the performance of an AI, another device, they could inject false data that is generated by one AI against another AI.
Oh, okay. I see what you mean. Now, Bijan, you also highlighted that drift, right? Even without AI, even in conventional medical devices, there are drifts. So are there any lessons learned from our experience with conventional medical devices that we can apply with to AI? Just a thought, if you would be able to share some brains, some top of mind thoughts on that.
Well, in conventional devices, we have clinical evaluations that are done periodically on medical devices to see is the device still performing as expected, are the benefits as expected, are the risks still as we thought. I think we will have to do that anyway, the clinical evaluations, even on AI systems. So I think lessons learned from conventional devices will also apply as before on AI devices.
Got you. We just have to be mindful. And aware of these pitfalls, right? So that we can. Okay, go ahead.
Yeah, one of the other things is that I think it was Raphael that was talking about using clinicians as supervisors or evaluators of the AI output, especially in diagnostic systems. Typically right now, medical device manufacturers rely on the clinician to verify the output of AI before making a decision. But one of the hazards is that when an AI device is successful many times in a row, human tendency is to become complacent and just trust without verifying.
Yeah.
So that's a risk that I see. However, this risk is not unique to AI. I think regular text-based algorithm devices have the same issue.
Got you. So guys, I'm gonna propose or raise like a very general questions for anybody on the panel here today to share their thoughts. In the end, developing an AI product is not in many ways different from developing a software-based product. And I know we have a lot of best practices in the software development space. Do you guys see any sort of parallels between the two processes or any gaps or deficiencies in our current approach to software development that we should be aware of when it comes to AI-based products? Just an open question for anybody.
Well, Naveen, speaking as someone who's originally trained as a software engineer and who's seen the agile development process that's used very commonly applied, my initial reaction is it's too slow. Namely, AI can evolve so much faster in a lot of ways than a human can keep up with it, or a team of humans could keep up with it, even running on an agile sprint team, trying to stay ahead of it.
Yeah.
That's the biggest concern I see right there, is just staying ahead of it. Because you always want to be a couple steps ahead, and you always want to be able to adapt. And agile software development lets you do that. But my concern there, my first reaction is could be just a bit too slow to stay ahead of AI.
So you are saying even agile product development practices today may not be sufficient. We have to be like super agile.
Super agile and super fast, and be able to get it right quickly the first time. We have to be able to stay ahead of the machine.
Got you. Thank you. Any other thoughts and comments from you, Emmanuel, Bijan, or Ed on this particular question that I just raised? I'm very curious if we can apply some practices or if there are some gaps that we should be aware of. That just Rafael, one of them he mentioned just now.
Yes, I would say that I would agree with both what Bijan said about security as well as what Rafael said about being fast and agile. Simply put, if you train your AI and keep it closed, meaning not out in the cloud, with a correct and verified data set that allows for extrapolation and preventing data leakage or keeping data leakage to an absolute minimum, then you actually are able to produce a product that can be a very indispensable tool and will be accurate more times than not.
Got you. Thank you for that. Wag, I know you have joined us and you are actually a practitioner in this space. So, in fact, I'm very curious to hear your perspective on AI in general in med space and where it's going. Tell us a little bit more about that.
Yeah, absolutely. I really like what this conversation is bringing up. And I think, to distill down what I want to highlight is AI is really just a collective information, knowledge, and intelligence from us, right? So we are the owners. And, it's a tool. And it needs to be looked at not so much as a competitor or some entity that we need to protect against. I think we need to look at it as a team member, as an augmentation, right? So we need to join it, and we strategically need to understand also its limitations, right? It only knows what it could decipher, which is not everything that we own and drive in life as humans. For example, it does not know enough about, emotional intelligence at this point, at least. That, of course, is going to evolve as every other technology does. But, just looking at it as a team member, imagine you have an expansive team of subject matter experts that are bringing to the table topics to discuss. And strategically, you want to look at what it is limited to, right? It does not know what is the totality of the balance or the decision-making that you will ultimately do for the patients, for the users in the regulatory space. But it does bring you substantial input. And I would strongly advise, rather than try to beat it or be faster than it, to invite, encourage, welcome at all its inputs, because it's only going to make your decision better, and it's only going to make you evolve faster.
Got you. Thank you, Wag. In a moment, I actually would love to invite you to share some brief, summary of the work you have done. You're doing some very fantastic work. But in the meantime, first I want to invite Phil. Phil, you have joined us. Please share what you have in mind about, AI in your space, where it's going, and what are some of your thoughts and concerns about it.
Thank you, Naveen. Just real quick, I've had a little experience, worked with Underwriters Laboratories. I ran an IoT house, and we were integrating the early versions of AI, which weren't really AI. And then later on, going into human factors, actually integrating, some AI into imaging and whatnot. And it's interesting because I found that AI can be considered a fix or a time saver, which absolutely can happen. But to a lot of people's points and that have already spoken, that we have to keep the human aspect absolutely involved. We also have to look out for laziness in humans sometimes, and just accepting, AI at its core is what it can do. And then obviously there's a lot of companies spending a lot of money on generating and teaching their AI. I think that's also very important, is that some companies tend to market AI as in their product, and it's not really AI, and being careful of the fact that that it's perceived as being better just because they're calling it out as AI in their marketing schemes.
Got you. Thank you for that, Phil. Now, I know you are very active in the augmented reality space. So do you see any intersection between augmented reality and AI? Where is that going?
Yes. I can't go into too much detail, but for what we're doing, but there's absolutely some aspects of how can we further. So we're talking about spatial reasoning, right, in augmented reality, and how can we bring AI in to help with that spatial reasoning, and helping healthcare professionals to do their job and make it easier for them. Yes, it is being looked at in many different ways. I can't go into the details of what we're doing, but yes, there is a crossroads.
That's great. Thank you for sharing that, Phil. Wag, I know we are running short on time, but I do want to give you an opportunity to share some of the exciting work that you're doing to the extent you can, and help us understand, what are some of the unique applications of AI we can have in our space. Go ahead.
Yeah, maybe I'll just highlight a minute worth of points. So I think what Phil just pointed out, we have strengths and weaknesses that are possibly different than what general compute and big data, because it's a tool that can process 1 million records where we could not, right? We do not have cognitive bandwidth to track so much data. So that's perhaps, the kind of the totality we want to look at is what are we stronger in? Of course, it's, as a tool, it can fill in efficiencies, productivities, and also the big data aspect, which is a problem for humans, right? We can only keep so much in our heads. at any given moment. So yeah, just back to, looking at it as another input, another stakeholder, another utility for us to reach better decisions and not be afraid of it, right? It's a multiplier, right? Instead of hiring 100 people, you have this tool that does not substitute or replace the people, but it makes them all stronger, more efficient, more on point for decision making and ultimate, achieving the goal, whatever that happens to be.
Got you. Thank you so much for that, Wag. Andy, I'm so glad you have joined us. And you are not from the medical device industry, so I'm actually very curious to hear your view on AI in your space and where you think it's going. How are you?
Yeah, I'm brilliant. It's great to be back. I'm sorry I've been absent for so long. I appreciate we're really short of time. Really great discussion. And because I'm not in the medical industry, I've been quite hesitant to join the panel today. I work in the automotive industry and in functional safety, and I'm a software guy. And I've actually used AI. I've used ChatGPT in the last few days to help me construct an argument around the reliability of a component. And I've used ChatGPT on and off for a year. I think it's an incredible tool. And the biggest takeaway I've got is it's made me better as an engineer. It's in my nature, and I'm assuming I'd be extremely surprised if this wasn't the case for everyone here today. When it tells you something, you feel you have to understand it. You have to approve the information it's giving you before you pass it on. I think Raphael had a great point earlier where it didn't pick up some things, and it was passed on to in his case, his superiors. But that's what the review process is for. So I wouldn't consider that anyone's failure at all. That's the process, his working process, being effective. But I've been looking at, in this case, I work to the ISO 26262 2018 standard for automotive functional safety. And I've been looking at reliability, and there's a metric, they call it FIT, F-I-T, failures in time. It's the number of failures expected in 1 billion hours of operation. And I've had to construct an argument about why that's not a useful metric for a particular class of device, which is a cycling. It's they're contactors, they're like relays. So they're rated on a number of cycles, not in a duration of operation. And I used ChatGPT to help me construct that argument. Now, I'm a software guy, so I had to go through quite a learning process. But it's made me better, and that's my experience.
So it's also good. You have now piqued my interest, Andy. How did ChatGPT respond to your request? And just very briefly, were you happy with what you learned from ChatGPT, or were there still some gaps?
There were still some gaps. I mean, I had to nudge it along the way. I'm getting better at prompting it. Yeah, and I think it's fascinating. I mean, for me, it's basically a language engine that knows it's got a lot of information. Yeah, and if the information if it's capable of understanding the language, it can do incredible things. But I wouldn't really. You've got to be very careful as you build up layers of understanding with it. Yeah, and quite. The classic thing with AI is for AI, the hard stuff is easy, the easy stuff is hard. It can do maths that I can't do, but it can't do some of the reasoning that I find very, very simple. And of course, ChatGPT, that's one of its big advances over other systems. And I don't mean ChatGPT particularly, I mean AI in general. Yeah. It's what's happened in the last couple of years is that computers are now starting to get good at what humans would class the easy stuff. Yeah. But I've picked up some very, very basic arithmetic errors. And I said, well, this, I know Ohm's law. That can't possibly be right. But when you engage it in conversation, it's actually quite pleasurable. Yeah. And it's bizarre. It brings out a kind of humanity in me. I'm polite to it. I keep asking questions. Right? I keep saying thank you. Yeah, absolutely. That's awesome. And it's actually a really wonderful experience. Awesome. It has made me. It's like I've used. I don't even know how to pronounce it. It could be Weeble or Vible. And I've been doing Vible analysis in the last day, which I didn't even know was a thing. But
that's awesome. Thank you, Andy. Ed, I think you have a couple of thoughts you would like to share about this document that is coming up, and we are very curious to actually learn more about it. Thank you.
Yes, Naveen, it's been submitted as a committee draft to ISO and IEC, and it should be out for vote until January. And then it will come back to us as a committee, and we will take any comments that are fed from the national committee. So if you're connected to a national committee for ISO TC 210, that's where you would find the information on the committee draft on ISO TR 24971-2, just to add the confusion. But anyway, the first committee draft is out for vote.
Got you, Ed. I think that is going to be very useful for all of us in the industry and practitioners. So guys, I know we have run out of time, but I want to thank all of you. This is what makes Let's Talk Risk conversations so amazing. We had like a technical problem today, and I called on you and you participated. This is the essence of community. And I truly appreciate you getting involved and raising your hand to just share your thoughts. As you can see, it's very casual and informal. Now, what I would love to have for those who are still on here on our panel, think of one question in your mind that is central in your space when it comes to AI. And I'll give you a minute to think about it, because I do want to announce a few things for our audience. Guys, those of you who are joining for the first time, know that we do this every Friday at 11 a.m. Eastern. And we are very planned, by the way. Today was a little bit of a difference. We have generally a speaker, and we talk with the speaker for about 15 minutes, and then we have an open conversation. So today was a little bit unconventional, but I'm glad that we had this general open conversation. So if you are new, put this on your calendar if you like these types of conversations, and just show up. The announcement for next week has already gone out. And in fact, we're going to have a wonderful discussion with Megan Kane about specific risk aspects for software-heavy IVDs. I know they are getting more sophisticated now. We'll also talk about the LDT rule a little bit. And if you're interested in those types of conversations, just show up. And lastly, I want to invite you to sign up for the Let's Talk Risk website and newsletter. Become a part of our growing community, and that way you will remain updated, stay updated for all the developments. So guys, I want to open the floor, and if you just want to share one question top of mind for you when it comes to AI in your space, what would that be? Anybody who wants to take that on?
Yeah, I can dive right in there. I mean, in the automotive industry, it's automated driving. Right? It's utterly terrifying. I guess it's the equivalent in the medical industry of having an AI do your diagnosis and write your prescription for you. But it's exciting but terrifying.
Got you. Thank you. Anybody else wants to share the top question in their mind?
I can go real quick, Debbie. More than just the medical field, but like just humanity in general, rather than having, or in addition to having AI help with saving time and make it more convenient for us, how can it help to make us safer and cause less, not only human error, but less injury, right? And also saving lives, how can it help with that? And how fast will it be integrated into our lives?
Great, thank you. Anybody else wants to share like a key question in their mind about AI in their space as a?
So Naveen, this is Rita.
Yeah, go ahead, Rita.
Mm-hmm. Yeah, so for me, right, being a regulatory person, the biggest question I have is how do we harmonize the regulatory framework across different regulators, right? Especially, right, some guidelines and some framework around these tools that we're building.
Wonderful. Great point.
But great discussion.
Thank you. Great point. Michelle, I know you have joined us just now, so we are kind of wrapping up, but I would love to have you share some key thoughts on AI in your space.
Yeah. Thank you so much, Dr. Naveen. Hello, everyone. I'm Michelle Wu, the CEO and co-founder of Nyquist AI. And great to see Ritam and a lot of familiar friends on the call. And we just published a book chapter with MIT Press with focus on leveraging AI for medical device risk analysis. And there are a couple of very interesting use cases. And first is use AI to navigate the genealogy of medical device. For example, for 510K, for de novo, and even for PMA, leveraging AI, you can look at so many similarities and to identify the genealogy of devices. For example, we have a customer that was hired as an expert witness on trial, and he leveraged the AI to defend for his client that there's no substantial equivalence between companies, and helped win the case. That was like really AI for legal, and it was so cool.
Yes, that's interesting, Michelle. So, I know we were planning to talk about it, and because of technical difficulties, we had some issues. So, Michelle, I'm going to really have you back and have a much deeper conversation about this one day, because you're working on some real-world examples, and it'll be great to hear from you. Guys, unfortunately, we have run out of time, and I'm very respectful of your time. So I'm going to close our session today just by, again, thanking all of you. I'm so thrilled to have this session today. You all kind of rose up to the challenge today with me, and I really, really appreciate that. Guys, a recording will be available, as always, on the Let's Talk Risk newsletter. Show up next week as well, because we're going to have a great conversation about the software-related aspects of IVDs and also the LDT rule that just came out. With that, have a good weekend, everyone, and we will see you once again next week. Thank you.